Hey, it's Jessica DaMassa with WTF Health. I'm here at Healthdatapalooza, and joining me right now, I have Kristin Valdes. She is the founder and CEO of b.well, and she has the largest set of live connected health data in the country. I don't know exactly what that means. So, Kristin, break that down. What does that mean?
So we are a consumer health management platform designed for consumers to access all of their health data. And that means that we go beyond the clinical records, beyond the payer information, into connected wearables, devices, smart homes, into their health tribes and family health histories, as well as their labs, genetics, genomics, biometrics. So we pull all of that data together. And then our platform creates personalized insights for end users as well as their caregivers on everything from their evidence-based medicine guidelines and gaps in care to financial and health literacy improvements. And our platform then recommends various point solutions that exist in the market at the time that they're relevant to a consumer in their own life and who pays for them. So we can also proactively make out-of-pocket cost reduction decisions for consumers and help them to decide if they want to save money and just give them options in a simpler way.
Okay, so how many people do you have signed up?
So we have right now over 50,000 active users on the platform, although we are currently contracted to be at just under 2 million in 6 months' time.
Well, that's a significant jump.
Yes, we are.
So your business is scaling. Yes.
Yes, we are rapidly implementing customers. We've been around for 3.5 years, and what's interesting is that the customer base that we expected would grow is not the fastest part of our pipeline. We sell into self-insured employers, payers, and integrated delivery systems, so the provider side as well.
Okay.
And so it's been really interesting to see the types of deals that are coming to us and with such large populations, because there's definitely a concerted effort to put consumers at the center of their healthcare, and that's exactly what our platform is.
So what was surprising? Like, who did you expect to be your customer?
We really thought that the employers and payers would be our initial early customers, large and small, but ironically, hospitals are the fastest moving segment of our pipeline because providers have this great need to move beyond the four walls of the hospital, to meet people where they are, to help with remote patient monitoring so that they can help treatments for consumers and patients to go into their own homes where they're more comfortable. So we're seeing a lot of that, and with our connected health data and devices, it allows physicians to do that because we can write back into their EMRs so they can still use the same workflow tools that they have in place today.
Okay, so you're, in addition to having consumers being able to access that data, those providers are accessing that data as well and then using it as a way to deliver care.
Yeah, absolutely. And that's what's beautiful about the way that we collect data is we do it on behalf of consumers. We never sell, aggregate, or advertise to them based on their data. We don't share it without their consent. But consumers do want their providers to see their holistic health profile when treating them. Yeah. So providers do have the ability to finally see the whole person, not just what happens within their own ecosystem with that patient.
Okay. Give me some specific examples. Like, I'm curious about like what this is like from the consumer standpoint, because we always talk about putting the consumer at the center of this and then giving them access to their data. And there's always, though, with that, like a concern. Like, is the consumer going to know what to do with their data? Are they going to be able to read it? Are they going to be able to infer the things that they need to infer around it? And I understand you have certain things built in to help them do that. So give me an example. Like, if I've got all of my records and all of my genomic profiling and all of that stuff together in there, what can I learn, me as a consumer?
Yeah, so from a consumer perspective, if we showed consumers their health data as it exists in core systems today, they wouldn't understand it because it's not written for consumers to understand. It's like the majority of health content in our country was written provider to provider, not direct to consumer. So we translate all of that and simplify it. We show things like labs and a longitudinal trend line and help consumers understand what is the lab, what part of the body is it measuring, why is it being measured. But the value really comes in what we call the easy button, making healthcare frictionless and simple. So wouldn't it be nice to be in a world where you get a push notification on your phone that says, hey, did you know that you could save $50 on your family's drugs this month by switching from CVS to Walgreens? Would you like me to transfer that script for you? Helping to really create, through these open access APIs that are now available within the marketplace, the ability to actually perform the work for the consumer and save them money, but also help improve their health literacy on their own data, making it relevant to them. So instead of talking to people about, potentially becoming pre-diabetic, we can say, here's what your numbers show. You're headed in the wrong direction. Would you like help with that? When they say yes, there's a whole litany of companies out there that are focused just on that issue, and we can surface them to the user at the time that they really want that help.
Okay. I want to know this is amazing how you guys are helping health consumers and also providers with their care. But I want to know from your perspective, you as a woman running this business, from a data standpoint, I mean, has your job been frictionless? And what friction points exist for you still in trying to get the data and the access to the data that you need in order to continue to build out your product? I mean, are there any things that's out there still that you wish, like, God, if I could only just change blank and have access to blank, everything would be working even better than it is right now?
Yeah, absolutely. Getting access to all healthcare data is not achievable in this market. There are still providers that don't surface portals to their end consumers. We have to put in place laws and penalties in this country in order to get providers to and payers, quite frankly, to adopt and also share that data in a transparent way. But even when that data is shared, it's oftentimes not mapped correctly, it's not comprehensive or complete. So we have to support unlimited data standards in order to get the kind of data that we have access to today. So in my ideal world, it would be standardized, simplified, everyone would adopt FHIR standards, but then they would also create the reverse, which is the push side of that. So we can push data back into the system through an open API versus having to install individually on each provider system.
Do you think we'll ever get to that?
I do.
Yeah.
I do. I think that there's a bright horizon headed our way, and I think it's happening faster than most people expect it will.
Why do you think that is? Or what do you think is going to be the thing that pushes that over the edge? I mean, I'm asking this kind of in a loaded way because I'm thinking to myself, like, God, I wonder, as like the big consumer tech companies start to come in and they have a whole different philosophy when it comes to APIs and when it comes to data exchange and things like that. Are we going to start to, in healthcare, adopt that mindset, you think?
Yeah, I think we have to because there are now regulations that require it, and there's finally going to be penalties behind that will almost mandate it. So payers and stakeholders, providers historically who held on to data as an asset, those days are gone. And so there was a big tectonic shift that happened in healthcare this year and last year that most people didn't see coming, and it happened very quietly until it was there. So I think that we're already on our way towards that ideal state. I don't think there's any stopping it, and I think that it's going to unleash the ability to create all kinds of new competitive business models where we're going to transform healthcare, and it's going to be more rapid than we expect because we are allowing entrants like the big tech companies in because they have the same access to information as the healthcare stakeholders that have been in it a long time.
God, I hope so. Until then, Kristin, thank you so much for stopping by and chatting with us. It's always a pleasure to speak with you and get your perspective on things. Thank you.
Thanks.
I'm Jessica DaMassa with WTF Health. Thanks for joining us.